Thank you very much, Paul. And I wish to acknowledge and thank Omics International, as well as the event partners, collaborators, and supporters of this event. I co-authored this paper with Colonel Dr. Larry Kaplan, clinical assistant professor of emergency medicine, a fellow faculty member at the University of Central Florida in Orlando, Florida. Along with Dr. John Spallino, I would like to acknowledge him and his assistance with this paper. We actually, in terms of disclosures, would like to say that happily this paper was accepted for poster presentation as a scientific paper at the International Society of Travel Medicine in Quebec City just a few weeks ago. And because of the rising incidence of severe, rapid, catastrophic events which can happen with air embolism, we thought it would be of value to start with a case presentation. And this involves basically a 43-year-old U.S. Navy diver who had no other comorbidities or medical conditions, who experienced severe shortness of breath following piercing left-sided chest pain radiating to his interscapular region of his back, associated with coughing and coughing up blood. He had complete loss of consciousness within 3 minutes after surfacing, following prolonged unintentional breath holding. And this is the key. We must remember not to hold our breath as we are coming up, because this can create a problem, especially in this particular case. He came on a rapid ascent from a depth of 110 feet in brackish water in a rescue attempt of a trapped U.S. Navy SEAL. The U.S. male Navy diver had the following vital signs, and this is the important part. His pulse oximetry showed an low oxygen level of 83%. Notice also that he was hypothermic. He had various clinical features. This is a droopy eyelid called a Horner's syndrome with a constricted pupil, facial asymmetry, where one side of his face was paralyzed, and he had some bloody froth at his nostrils and also in his mouth. And this is a characteristic finding, Liebmeister sign, which is a pale oval area on the tongue, which is characteristic for this condition. If you use an ophthalmoscope, as medical doctors do, to look in the back of the retina, you can actually see air bubbles in the retinal blood vessels. Patients can have laryngospasm of their vocal cords, possible deviation of their trachea, subcutaneous emphysema, which is like a bubble wrap type of finding underneath the skin, and there can be diminished breath sounds when we listen to the chest. There can also be a variety of different cardiac murmurs. Patients can be nauseated, vomiting, singultus, which are hiccups, can happen. Abdominal distension, sometimes there can, from the pressure gradient, result a perforated viscous and abdominal organ or the stomach or intestinal tract actually perforating, releasing air into the abdominal cavity. The patient might be incontinent of urine or stool, and this is another complication of this condition. And again, various neurological conditions involving blurred vision, disorientation, and cranial nerve involvement. Even in severe cases, we may see patients having convulsions or seizures or sudden loss of sphincter control, and they can even show findings of paralysis, unconsciousness, or a spinning vertigo type of sensation. Now here we see the central cyanosis, which is the purplish discoloration resulting from the diminished oxygen level, as well as peripheral cyanosis of the blue-purplish discoloration of the tips of the fingers. This is a sign of subcutaneous emphysema. As you can see, the air is tracking up from this event happening where air gains access into the various tissues. If you're at a beach and you see this happening as a diver is being brought unconscious, if you see this particular lace pattern called cutis marmorata. This is typical of air embolism. So we made the diagnosis. There was, by pulse oximetry, it showed hypoxemia. Doppler ultrasound is useful in terms of color flow imaging. It's important to get a chest x-ray to see if there's a collapsed lung. The EKG will show these findings with irregular rhythms. And this is particularly important. An echocardiogram can reveal holes in the heart. This is an atrial septal defect, ventricular septal defect, valvular abnormalities, and transesophageal echo, where they pass a probe down into the esophagus, can reveal a patent foramen ovale, and I will describe that shortly. A foramen ovale is the oval window which separates the two atria, the upper chambers of our hearts. With amniotic fluid in our lungs, when we are a fetus in our mother's womb, there is no separation between the venous and the arterial, the right and the left side of the heart, because there's a hole called the foramen ovale. When we are born, when we take our first breath as obligate aerobes, breathing ambient air into our lungs, the foramen ovale closes, but it doesn't shut completely. It closes, but has the potential to be opened. So when we go diving, it's important to know, because about a third of us, 27 to 30% of people, have a PFO, a patent foramen ovale, and if they're not aware of it, when they dive, that can open and air bubbles can travel from the venous circulation into the arterial circulation, and if it exits the heart and goes up to the brain, it can cause a cerebral arterial embolism, which can be quite serious and dangerous and potentially fatal. These are the various tests. I won't labor on these. These are the standard tests we do. We can certainly do CAT scans and MRI scans, but essentially, prior to diving, it's important to get a diver fitness test. Very quickly, what do you do if you were to see this on a beach? Put the patient feet up, head down, and turn them on their left side. Tilt them on their left side. This traps any air bubbles in the right atrium. That means it won't cross over into the left side of the heart and will then not be able to travel up to the brain, because that's what we're trying to prevent, is cerebral brain embolism. So this is the most important slide. If you see this, put the patient head down, feet up, and then into left lateral decubitus position. Treatment, most important, is hyperbaric treatment. Of course, we start with high flow oxygen, securing the airway, treating any irregular heartbeat, anticonvulsants to stop seizures, and proper rewarming protocols if the patient is hypothermic, which we don't see too often in Florida. But I did practice in Canada for 10 years, so I'm very familiar with hypothermia and having seen patients with that. Hyperbaric oxygen treatment obviously is life-saving for patients like this, and the distinguishing feature with air embolism is that it's on the order of minutes. The bends and nitrogen narcosis, that and decompression illness is usually something that develops over hours, even several days after diving. But this is much more catastrophic because it happens in a matter of minutes after surfacing, often when people have held their breath. So these are the treatments. We hyperventilate the patient, give steroids and IV mannitol, and monitor their intracranial pressure. Prevention, avoid breath holding on rapid ascent. That's the important part. Also, after you've gone diving, especially deep diving for prolonged periods, you need to avoid air travel because of the pressure gradients. You cannot fly at least within 48 to 72 hours after diving. Having a thorough certified medical fitness to dive examination. Vigorous aerobic activity 2 hours prior to diving seems to reduce the risk. And also making sure that there's no faulty diving equipment or improper combinations of compressed gas from the scuba cylinder This is the life-saving number for the Diver Alert Network, which people can call even first rescuers. I was involved as medical editor for the Diver Medic and Aquatic Safety magazine, which was recently launched out of London, England. And they're involved in rehabilitating military veterans with something called depth therapy who've had amputations. They have particular special requirements when they go scuba diving, which has been marvelous for their rehabilitation. But they are actively involved with Dan Europe as well in the training of divers. And as we all begin to dive, we need to dive safely. Thank you very much for your attention.
We have time for a few questions. I just really want to thank you very much for that presentation. I've been diving for 40 years, and I'm aware of the problems with air embolism and with nitrogen and so forth. But it's good to know, firstly, the symptoms, and secondly, the treatment, the first aid and beyond. So thank you very much for that.
Good. Thank you.
And you have something. Okay. Right. If I remember correctly, I think we have a video presentation. Dr. Chiara Facca from Ca' Foscari University of Venice, Italy, is here but not here. We're going to see a video presentation of his talk, which will be cut off at 20 minutes. Huh? 18? Okay, good. And the title of that talk will be Multimetric Phytoplankton Index, MPI, Description of the Method and Study Cases in the Mediterranean Sea. So we'll wait till this thing gets geared up here.
Welcome to my presentation. I'm Chiara Facca from Ca' Foscari University of Venice, Italy, and I'm going to talk about the use of phytoplankton as ecological index. The literature proposes several formulations based on phytoplankton metrics. Already in the 60s, chlorophyll A has been among the first parameters used to assess trophic conditions. In the following years, several formulations were proposed using combination of biotic and abiotic parameters, as an example, nutrients together with oxygen saturation and chlorophyll, or cell abundances. The present proposal was developed on the basis of European Commission's regulation issued in 2000. The Water Framework Directive WFD number 60 of 2000 has three main objectives. The first one is to protect inland surface waters, transitional and coastal waters, and groundwater. The second one is to prevent deterioration of all surface water bodies, and the third one is to achieve the good surface water quality status by 2015. According to directive guidelines, the assessment of water bodies must be done using the following biological quality elements: phytoplankton, aquatic flora, benthic invertebrate fauna, and fish fauna. For each biological quality element, taxonomic composition, abundance, and biomass must be used. This approach is a significant change against the previous regulations that gave more relevance to chemical analysis than to the study of biological communities. First of all, I'm going to describe the index. Then I will show you the results achieved during the setup procedures. And at the end, I will show you the new results used for the validation phase. The index and its setup for transitional waters are described in the paper FACA et al. 2014, issued in Marine Pollution Bulletin. The metric phytoplankton index MPA can be applied having data of chlorophyll A concentration, phytoplankton cell abundances, and taxonomic composition. Law guidelines indicate that sample must be collected at the surface seasonally in the months of February, May, August, and November. However, a higher reliability can be achieved by monthly samplings, as done with the dataset here discussed. Chlorophyll A must be determined in laboratory by using the spectrophotometric or fluorimetric methods. Phytoplankton taxonomic composition and abundance must be determined at the inverted light microscope according to the Utemors method. All these methods are well known and widely used, but the identification of small cells below 5-10 micron at the light microscope may be difficult. For this reason, only items clearly identifiable to species level are retained in the taxonomic list, including the taxa that can be indicated as genus SP1, class SP1. Multiple indeterminate taxa, such as genus SWP, Cryptophyceae SWP, or flagellates, marked in red in the table, have to be removed from the main list and grouped under the term multiple indeterminate taxa. The taxonomic list without the multiple indeterminate taxa is used to calculate total abundance of determinate taxa. The MPA is composed by 4 metrics because the inclusion of additional metrics can render an index more sensitive. The first metric is the dominance Ulburt's index. It was chosen because in general dominance phenomena occur in impacted areas. Their formulation includes the number of cells of the 2 most abundant species and the total abundance of determinate taxa, as previously specified. The final value is a percentage, meaning that 100% only 2 species were recorded in the samples. In order to relate Ulburt's index to water quality, the value 100 minus dominance was used as indicator of high water quality. The second metric is the dominant species frequency, namely the number of times in which the abundance of a single species exceeded 50% of total abundance at each sampling site in the entire period. The final value is a percentage, meaning that 0% no dominance occurred. 100% bloom of a single species is persistent during the year. Also in this case, as well as for the first metric, the numerical value referred to the high quality is 100 minus bloom frequency. Mix diversity index is the third metric. It is calculated as the ratio between the number of species and the total abundance square root. To reduce the error caused by deletion of multiple indeterminate taxa, a correction factor was introduced. This factor is calculated as the ratio between total determinate taxa and the original total abundance, namely the sum of determinate and indeterminate taxa. For each sample, diversity index is multiplied by this correction factor. The highest are the index values, the more diverse is the community, so this metric is directly related to high quality. Chlorophyll A concentration is the fourth metric because, as said previously, it has long been used to assess trophic conditions and because it represents a proxy of phytoplankton biomass as required by directives guidelines. The chlorophyll A raw data are log transformed and outliers, which value outside the range of mean plus and minus 2.5 multiplied by standard deviation, were moved in order to create a more robust dataset. Considering the new dataset, annual average concentration are calculated for each sampling site, and at the end, the anti-logs calculated. To combine the four metrics, the ecological quality ratio EQR had to be calculated. The EQRs are calculated considering the reference values, meaning a description of the biological quality element that exists or would exist at high status. In case of chlorophyll A, the EQR is calculated at the ratio between the lowest chlorophyll concentration, meaning good water quality and low trophic status, and the annual mean value of each site. The reference conditions are selected on the basis of the best condition of considered water bodies. For the first three metrics, the EQR is calculated at the ratio between the annual mean value of each site and the highest value. The MPA is calculated as the mean of the four EQRs. In this way, the EQR varies between 0 and 1. In accordance with one of the options provided by the directive, the index range was equally divided into 5 ecological classes. The classes between 0 and 0.2 is the bad status, namely eutrophic condition with very low biodiversity, opportunistic species dominating the phytoplankton community and leading to very high chlorophyll concentrations. The class between 0.21 and 0.4 is the poor status. Then we have the moderate status for the values between 0.41 and 0.6 and the good status between 0.61 to 0.8. At the end, we have the high quality status between 0.81 to 1, indicating communities characterized by an equilibrium of species with consequent high biodiversity, low chlorophyll, and nutrient loading. The water body typology is one of the supporting factors in determining ecological status, and it is a characterization of all water bodies in terms of the physical and chemical factors that determine the features of transitional water. The purpose of typology is to enable type-specific reference conditions to be established. This is necessary because the high ecological status can be different and thence can be different the reference conditions. For Italian transitional waters, two main typologies were identified, choked and restricted. According to the literature, choked lagoons are characterized by one or more long and narrow entrance channels, long residence times, and dominant wind forcing. Restricted lagoons usually exhibit two or more entrance channels or inlets, have a well-defined tidal circulation, are strongly influenced by winds, and are usually vertically mixed. Residence time are shorter than in choked lagoons. Here are the results of set-up procedures for the restricted area of Venice Lagoon until 2008. This basin, 550 square kilometers large, is characterized by high spatial heterogeneity and several anthropogenic stressors, such as industrial and agricultural discharges, tourism, fishing, hydromorphological interventions, naval traffic, and so on. Most of these activities are affecting the central zone, and as a consequence, most of the studies were done in such area. A clear gradient of decreasing ecological status can be observed moving from the inlands toward the mainland. Marked by TH is the area characterized by high quality status that represents the reference conditions. The other inlet has only good and not high status due to the urban wastewaters from the historical center of Venice. The sites close to the mainland are in moderate or poor status due to the proximity to urban and industrial areas. Data on nutrient concentrations were available for all considered sites, and the factor analysis highlights significant indirect correlation with high nutrient concentrations. In 4 sites, also values of main contaminants were available. The MPA resulted indirectly correlated with all heavy metals and organic pollutants, except for nickel and chrome. This suggests the MPA can be an indicator of ecological status and not only of trophic conditions. Our current activity is to verify the MPA reliability using data from Venice Lagoon after 2008 and of other Italian water bodies. In particular, we are verifying the response also in choked basins. For this purpose, we collected and compared data set from 8 sites in Venice Lagoon with 11 sites from 4 basins of Sardinia Island. For all sites, monthly samples of phytoplankton taxonomic composition, salinity, nutrient, and chlorophyll concentrations are available. Data on the assessment of Sardinia ponds were already published in Bazzoni et al. 2013 in transitional water balloting, whereas data from Venice after 2008 and statistical analysis were never published. Venice Lagoon and Sardinia Island are both in the Mediterranean area, but they face 2 different sub-basins, the Adriatic Sea and the Tyrrhenian Sea. The sites in the restricted area of Venice Lagoon with the up-to-date data after 2008 display an improvement of ecological status in the industrial zone, whereas the urban site keeps the same condition as previous. The checked basins, never studied before, has all the same conditions that are moderate. The considered Sardinia ponds vary between 0.87 and 27.8 square kilometer and are mainly used for fishing and aquaculture. Moreover, they receive the agricultural, urban and zootechnics wastewaters from the countryside. The classification indicates all basins in poor or bad conditions in accordance with the literature on the areas. Comparing all data from Venice and Sardinia lagoons, both uni- and multivariate statistics indicate significant correlation with salinity that in developed countries can be considered a proxy of contaminated inputs, being most of wastewater discharged in fresh waters. Other correlations were found with reactive phosphorus and ammonia. In restricted zones, a high heterogeneity is usually observed. The proximity to the sea favors good conditions, whereas close to industrial and urban areas moderate conditions prevailed. In choked zone, on the other hand, water conditions were generally uniform both in Venice and Sardinia. However, Sardinia displayed bad, poor conditions. These results are in accordance with the literature on the area. Moreover, the statistics shows significant relationship with salinity and reactive phosphorus. Further elaboration will include a higher number of water bodies in other regions and the final validation of reference conditions. At present, one of the problems is that most of the data were collected only in impacted sites, and few or no information are available for undisturbed area, complicating the identification of reference conditions. Thank you for listening. If someone would like to help us in the validation of the index, adding data on phytoplankton, here is my mail address. Thank you again.